Before we get started, I have a bonus for you. Your first CEU from this season of School of Speech is free. Visit speechtherapypd.com to enroll in an episode and use the code SOS25 at checkout. Now back to the episode. Hello and welcome to School of Speech. Woohoo! I'm your host, Carolyn Dolby, and this week we are looking beyond disfluencies with my new friend, Claire Barbao, who is really bringing it for us. You're going to love her take on school-based stuttering, from rethinking how we write goals to taking data, really sharpening our lens to truly be student-centered clinicians. I want to remind everyone that this episode is also worth 0.1 ASHA CEUs when you complete the accompanying course on speechtherapypd.com. All right, on to the interview. Welcome, Claire. Hey.
Thanks. Hi, Carolyn. Thanks so much for having me.
We are so excited to have you. Before we jump in, we have a few little housekeeping. I just need to go over our disclosures right quick. So, Claire, you are the owner of Kindly Speech LLC. You're also employed by the University of Virginia, and you receive royalties from MedBridge. And today you're receiving an honorarium for your participation. So thank you so much. Non-financial, Claire is a part of the National Stuttering Association, leader of Central Virginia's chapter, and she's a member of ASHA's Special Interest Group 4. For me, I'm a salaried employee of Portland Public Schools. I'm compensated for my graduate courses that I teach. And I am also compensated from Speech Therapy PD for hosting School of Speech. Non-financial is I'm a consultant for school districts across the nation. I also am a member of ASHA's Special Interest Groups 13, 14, and 16. Enough about me. Claire, I want to let some people know kind of your background here. You are a clinical supervisor at the University of Virginia and a candidate specialist recognized by the American Board of Fluency and Fluency Disorders. Your primary focus is current clinical practice and instruction in fluency disorders, motor speech disorders, adult rehabilitation, and culturally responsive intervention. Claire's clinical experience includes both inpatient and outpatient and medical settings. Claire, I think I already mentioned, owns the private practice Kindly Speech. I love that, where she sees clients and provides education to parents and the SLP community. She believes in providing person-centered therapy services and engaging collaboration with families, caregivers, and other professionals to best support her clients. Claire, you are amazing. Thank you. No, thank you. Okay, I'm so excited to have you here today. I really am interested in how you got to where you are. Can you give us your origin story?
Absolutely. I love doing so. I first want to say I absolutely love being an SLP. Like you've said, I've kind of been all over the place as an SLP, though. I've had my toes dipped in a lot of different areas, which I love about, again, being an SLP, because it does allow us the freedom to work in a variety of settings. So I attended the University of Toledo in Ohio, and that is actually where my love for fluency disorders and my passion for this disorder area started. I worked under Dr. Rodney Gobble, who is a person who stutters himself and also a professor and researcher in the field of stuttering. And I was lucky enough to have him as one of my first professors in communications and sciences disorders. So that was really cool. And he actually started the Northwest Ohio Stuttering Clinic at the University of Toledo. So I worked in there as a graduate student. And then once I gained my C's a couple of years later, I went back as a supervisor. So that's really where, again, my passion for this area of the field developed. But going along my work journey, I started in the schools. So I was in the schools for 2 years. And then I also, at the same time, was doing some PRN work in acute care because I knew I wanted to keep my knowledge base in the adult population because I was interested in the adult population and didn't feel like I had a ton of experience from grad school. So I did that for the time I was in the schools. And then my PRN position actually led me into outpatient pediatrics
Mhm.
in the same hospital system. So that's when I went into outpatient, and I continued in acute care doing some PRN work. And then COVID happened.
Yeah.
And I mean, nothing crazy really happened except that I moved to Virginia from Ohio during
Wow.
COVID. Yes, my husband started his residency program here. So we moved to Virginia, and I got the opportunity to work as a clinical supervisor at UVA. It was just kind of the stars aligning.
Mhm.
And at the time, I didn't know that I would get this job. It wasn't open yet. So when we moved is actually when I started my practice Kindly Speech, because I had hoped actually, or the plan was to start seeing some clients privately, because again the world was shut down
Mhm.
and people still needed speech services. And what I was finding was there wasn't very many people who specialized in fluency disorders. So that's really when, again, about 4 years ago, that's really when I tried to commit myself to finding out more about fluency disorders. I knew I was interested in it, but I really wanted to become specialized. I really wanted to provide more information for parents and for caregivers and even for SLPs about that area, because I just felt like there wasn't enough. And keep in mind, that was 4 years ago. And I feel like within the last 4 years, even five, there has been so much research in the area of stuttering. And so I feel like I've been really lucky in the sense of I jumped into this area at a really excellent time for growth and for knowledge, because there's been so much development. And I think we know now that stuttering can't just be about the behavior. We need to look at the emotional and cognitive aspects. I think it's still a question of how, which is what we're going to talk a little
Right?
bit about today. But that's, I think, where in the last few years I've really tried to look deeper at, is how do we provide quality services, especially to children, in the area of, if we're looking at like ABCs of stuttering, how do we provide services in the affective and cognitive areas? Because we know how to provide behavior services. But the problem with providing the behavior services is that we ultimately start to send messages that we need to fix those behaviors or fix the stuttering, and we want to get away from that. So I've seen those private clients. I've had a great private client base on the side of being the clinical supervisor, and then I also see the stuttering clients in this clinic. And I've been really involved in the fluency disorders course. And in the last year, I became a candidate specialist, as you said. So I meet with my mentor monthly, and I'm working on, it's almost like a thesis, to be honest with
Mhm.
you, but it's a report that you build about cases that you're working with, cases of students through the adult population who stutter, and you eventually submit it to the board, and that's how you become specialized or have your specialty license. So right now I am just a candidate, but that spans for about 3 years. So I'm working toward that, and I'm really excited because I do think becoming specialized opens up just you as a professional and getting your name out there, and connects you with those types of clients that you really want to work with and specialize in. So I'm really excited for that. And I just feel like it's a constant learning experience. I think if anybody wants to be certified in anything, it's a great move, because you really learn a lot and you learn updated practices and you always know what the next research is.
Mhm.
I think it's really hard sometimes for us. We're so busy, our caseloads are so big, and I get that. But if we have a passion for an area, if we can really dive into that, we can make such a difference. And it's so interesting, and things are constantly changing. And I love that about our field. So I'm really happy with where I am right now. And yeah, that was the long version of
No,
me.
I love it. I love it. And you're
Yeah.
right. Being school-based clinicians, even though we think you can't always be a specialist, yes, yes, you can in your district.
Right.
I I specialize in feeding and swallowing and
Oh,
dysphagia,
great. Hmm.
in the schools,
Wow.
and so, yeah, I know there's a niche for everyone.
Yeah.
I know. I know. I always laugh at myself because I'm like, I'm a speech pathologist and I'm constantly falling around my words,
Me too. It's
stumbling.
okay.
And I'm
Yes.
like, you know what? We're all real. It's
Yes, we
okay.
are. Exactly.
So I love the fact you're going for board certification. I think that is stellar. And so you are the person I need to ask.
Yeah.
what are the current best practices? I think,
Great
we
question.
want to know as school
Yes.
based clinicians, we do. It is really important that when we are serving our students in the school setting, that
Yes.
we are using the most evidence based, best practice, up to date, keeping up with what our needs are for our caseload. So, if you could start us off with that.
Absolutely, yes. And I want to start by saying too that if you are a school-based SLP or any SLP
Mhm.
listening and you have been treating students who stutter and using these behavior practices I'm going to reference, it's okay. You are doing the best you can with the information you have. And I don't want people to get stressed or feel like they're doing harm because you're not doing harm. You're not harming your students. But I do think that there is a better way than just behavior strategies. And what I mean by that is turtle talk and stretchy
Oh.
speech and slow down, take a breath, all of these things that are changing the behavior of the stuttering because what it's doing is it's putting a band-aid on the stuttering for the time. It might
Mhm.
make them more fluent. I am not here to argue that those strategies don't increase fluency. They do. But what we're finding from talking to adults who stutter is that they are working so hard to do these strategies that it is affecting their mental health. It's causing
Mm.
anxiety. It's even sometimes on the really drastic end causing suicidal thoughts. It's causing a lot of harm is long term. And so what I want us to do for our students is to start by looking at that cognitive
Mhm.
reaction and that emotional reaction so that we can prevent them when they're older feeling like they're not a good talker and feeling like they have to do these strategies in order to be accepted or embraced as a communicator. So again, I don't want anyone to feel like they're wrong necessarily. I just want to suggest to add some things. I do think that strategies have a time and place. I do still teach strategies to my students because I think that they should have autonomy if they want to use them. But I always
Sure.
talk to them about how important it is to not use them all the time. I don't feel like they need to use easy onset or slow
Mhm.
rate every time they open their mouth. But what they can do is know how to relax their articulators, how to decrease the tension, because what we know is about stuttering is that tension happens when we stutter. And if we can release that tension, it does make the stuttering a little bit easier, even if the stuttering still happens. Doesn't mean it completely goes away, but we can start to kind of modify and be aware of our muscles and that mindfulness as opposed to just, oh, slow your rate or take a deep breath and then start talking. So when we're looking at fluency shaping strategies, I really don't use the old practices
Mhm.
of again those easy onset like contact all of that. I do more of an awareness and mindfulness approach where we're learning about the speech machine. I know everybody knows that, but along with that, knowing how stuttering affects the speech machine. So oh, my voice box feels really tight, or oh, my the muscles in my jaw and my mouth feel really tight, and then how can I release those? I do a lot of body scans, I call them, with
Mm.
the mindfulness practices, so learning how to tighten and release it so they know what it means, they know what tension means because we have to teach what that term means. So that's the behavioral side. I think it's still important to teach about the behavior, but we have to look again, if we're going into the ABCs of stuttering, we have to
Mhm.
look at the affective and cognitive pieces. And I think that those get pushed to the side because a lot of SLPs just don't know how to incorporate strategies for that. And I think there's a lot of different ways that we can. And I also think that SLPs think that they're not able to because it's out of our scope, like it's a counseling based strategy. And
Sure.
to that I say we are the experts and communicators though, and part of communication is emotions and how we think.
Mhm.
And I think we're all as a field trying to go more toward person-centered therapy and allowing the client to be the driver and in charge of their goals and all of that. So looking at those pieces is really important. So I think a main thing that I work on with kids is coping skills, and this kind of goes into the box of cognitive behavior cognitive behavior therapy. So we start with really just identifying simple emotions and then defining emotions and talking about emotions, making sure they know that it's okay to feel these certain things. And I do this in a broad sense. And then I move more to, okay, a speaking situation. How do we feel in speaking situations? And then we move into, okay, when I feel these things, what can I do? Because I think that's what gets missed, right? Like these kids, they can identify how they're feeling. Okay, yeah, I'm feeling mad, but then what do I do to cope? How do I get out of feeling mad? And so, how this interacts with stuttering is these kids are going to run into situations, if they haven't already, where their speech is going to frustrate them, whether it's they feel like they can't get the word out, somebody interrupts them, somebody talks for them. And
Mm.
these little tiny experiences build up over time, and they start to feel like they can't say what they want to say, or they feel like, again, they're not a good communicator. So finding them these coping skills to cope with what reactions people are having and what they're feeling in relation to their stutter is really important early on. And these kids can handle it, is what I've seen. As long as we use kid friendly terms and we do it in a way that makes sense, they can learn these things. And what I've also found is most of the kids I work with, and when I say kids, I'm talking more so about like 5 and up. I'm not really talking about
Mhm.
the preschool age. I'm talking about like kindergarten and up. Um, Most of the kids who stutter are already experiencing some sort of behavior difficulty, whether that be some impulsivity, whether that be, I just saw a client this morning actually who is, his mom defines him as becoming the class clown, and
Oh.
he's trying to be heard because when
Mhm.
he's funny and when he makes these voices, he's not stuttering. But when he is stuttering, people talk over him or don't listen to him. So he's finding coping skills that aren't necessarily healthy or
Mm.
good for the school environment because he doesn't know how to manage how he's feeling and he doesn't know how to respond to those stuttering moments that are happening. So we're working really hard on the coping skills and we're doing zones of regulation if you guys are familiar with the
I
zone.
am,
Good, yes,
yes.
it's a wonderful, wonderful program. I love it. I used it when I was in the schools with a lot of kids, but I love it for this population because my kids can really resonate with the different colors of the zones,
Mhm.
and we've got that Inside Out movie now that fits really nicely within the zones, so we can have characters, and it's really fun because it can overlap into the classroom, it can overlap to home, and parents and teachers can use the same type of verbiage really easily about, okay, I think we're in the yellow zone. What can we do? How can we get back to green? And that's kind of what we work on for that emotional regulation and emotional awareness piece.
I think I love how you're connecting it to their behavior
Hmm.
and shaping it to when you're talking about coping skills.
Hmm.
I love the fact that so he's found a way that when he makes a voice that he's
Hmm.
not stuttering, but how do we shape that? You,
Exactly.
how do we shape that giving him because he does well, I guess my question is more like,
Yeah.
how do we shape them to have to stop people from talking over me
Right.
or finishing their sentence because
Hmm.
right because they're the obviously the listener is uncomfortable
Exactly. Well, and
and
and that's a piece of it. That's a huge piece of it. And so advocacy is, I always have a goal for advocacy even starting from 5 years old. So we learn, or the child learns, how to respond when people talk over them, interrupt them. I've had, again, kids as young as 5 say that other kids will say, "Why are you talking like that?" And the kids don't mean anything by it. They're truly curious
curious.
what's happening because they don't know. So these kids from an early age can learn how to define stuttering and talk about it in a way that's neutral and not
Mhm.
confused and not feel afraid because they're the only one that seems to get stuck when they're talking, and they can have a very, again, neutral stance to, well, it's called stuttering. Sometimes it takes me a couple seconds to get out the words I want to say, or sometimes it just takes me a little bit of time. We usually practice advocacy in that way. It's called stuttering. Sometimes it takes a little bit time to say the things I want to say, or it's just stuttering, and then the kids can ask about it if they want. But I
Mhm.
really think it's important for kids to have almost a script ready to advocate for themselves when things like that happen. Interruptions can be as simple as, "Hey, I'm still talking," or
Oh.
even like, hey, hold on, even waving if they're stuck in a block, because I found that's a really, really hard situation, is if there's a child who is a pretty severe stutterer and gets blocked really for a really long time, the feedback that I usually get, or the question that I get, is, well, if they're blocked and they can't advocate for themselves because they're so stuck that they can't get the word out, what do you do? And I say, well, we can do a lot of nonverbals. We can say, hold on, I'm getting it. And they can advocate again in the way that they can do, in whatever way that they feel most comfortable. But I think the first step is letting them know it's okay to talk about stuttering, because I think that it gets such a negative connotation just from media and songs. And I mean, think of how many movies or commercials even you've seen where somebody stutters and it's seen as a negative communication
All the
difference.
time.
Right. So
Yeah.
it's unfortunate that we're still dealing with that. And I know that we're dealing with that in a lot of other disorder areas too. And I hope that that continues to get better. But right now, we do need to teach people, the listeners, that in real life, people who stutter just need a little extra time. They're not different than anyone else. They know what they want to say. They're not a bad communicator. Sometimes they're better communicators than the rest of us. We just have to give them a little bit of extra time.
We have to allow them to communicate in their way
Exactly, in their way.
and help them feel comfortable, not make us feel comfortable.
Exactly. Yes, exactly. It's not about us.
Right, right. I love the idea of really the advocacy piece of that.
Mhm.
I think in the schools I could see how needing to do some adult education.
Yes, absolutely. Thank you for saying that. Yes.
Yeah.
Yes, I actually just talked with a bunch of school-based SLPs about this, and I would highly recommend, if you can,
Mhm.
to educate your teachers, not just your teachers, but the paraprofessionals, any other
Mm.
professionals that are going to be in your child's or in your student's world. So we're talking about the lunch aides and the
Yeah.
recess monitors, and just really everyone who might have a reaction to a student who stutters. And this can be as simple as making a little handout that you just give people to educate them on what stuttering is, how we don't need to respond in a negative way, how we can respond just by waiting. Most kids just want you to wait to let them finish, and just allow them to know what stuttering is, because knowledge is power, right? So I think if our SLPs in the schools can educate others, we can go so far with it. And I think that others in the school will be able to respond in a better way, and they'll feel thankful for that. So, again, I think it's as easy as just giving them something. If you're in a position to have some sort of like education, so professional education or
Mhm.
professional development, even if it's just an hour to talk about stuttering and to talk about some of the cases that you have in the school, to let your teachers and your other professionals know what's going on and what those individuals benefit from most, that would be amazing. I know we all have all this extra time to do that. But again, I do think it's important to at least let others in their life know that, yes, they stutter. They're the same as everybody else. This is what they benefit from. This is what we're working on in therapy. Like I said, with the zones of regulation, I
Mhm.
always make sure they have that on their desk. I think that a lot of school SLPs will have like the turtle or whatever on their desk
Right,
for
yeah.
strategies. And again, I understand why, because we're trying to carry it over in the classroom. So kudos to you for doing that, because you are trying to generalize the skill, and I appreciate that. Again, the challenge though is that if this child feels that every time they open their mouth they have to use their turtle talk, one, they're not being their authentic self, and
Right.
two, it's exhausting. Think if you had to monitor. I think actually Carolyn and I were just talking before this on how we try and monitor our ums, because
Yes.
we both recognize that we have a lot of interjections because we have a lot to
Mhm.
say and we're thinking as we're talking. Well, imagine if we every time we said, and we had to think back and be like, oh, don't say that, don't say that. And it's exhausting, and it's kind of sad, and it makes me frustrated with myself. It's the same type of thing. So we really can't expect these kids who are younger and also more impulsive and don't have as much of that self-regulation. we can't expect them to monitor their speech like that 100% of the time. It's just not doable and it's not kind to them. So again, that first step is really letting them know it's okay to stutter. Nobody said that's wrong. It's really
Yeah.
okay, and to stop sending them messages that it's not. And unfortunately, if we tell them to use strategies all the time, that's sending them the message that stuttering is not okay.
Right. And
And
telling them that their talking is wrong.
exactly. Right. Right. Even if we're not
Yeah.
necessarily saying that. And again, I know that SLPs aren't saying that, but over time that's what the message being sent is.
Hmm.
And that's what we're seeing, especially from talking with a lot of adults who stutter, is that's truly what that's what they will report their SLP said even. And
Yeah.
I would venture to guess that it might not be explicitly said, but it was the message that they received by being told they had to use these strategies so much.
I think they say, what is that? It's not always what you say, but how you say
How
it.
you say it.
And,
Yes.
and the meaning, right. Because, right, they're picking up the bigger meaning,
Exactly.
which is that I need to change the way I speak versus,
Exactly.
and I guess what was jumping in my head was masking.
Yes.
When we think about neurodiversity
Exactly.
and how exhausting that is for our students,
Yep.
our population on the spectrum that have to mask, feel
Exactly.
like they have to mask to make us comfortable.
Right.
And why are we, that
It's
is
the
so
same thing.
powerful.
Exactly. And it's the same thing. And I think that's what's so exciting about our field right now is that not only in the area of stuttering, but like you said, in the autism community, we're
Hmm.
looking at this picture of neurodiversity and we're saying, hey, these
Yes.
differences are actually okay. You don't have to change yourself for somebody else. And I think that's so cool
Yeah.
that we are embracing that as SLPs. I think the challenge again just is okay, how? How do we make goals for that? How do we take
Yes.
data for that? It's this constant how, and especially when our caseloads are so big and when we don't have enough time. And I think that's again going back to what we said before, Carolyn, about being specialized in an area. That's why we need people
Hmm.
specialized in certain areas so that you and I can educate others who aren't specialized in stuttering and feeding
Hmm.
on what to do really quick so that they feel confident. We'll do all that back end work and then we'll tell you what to do. You don't have to be specialized in everything. And I think sometimes we get stressed that we need to be, but you don't.
Exactly. And well, being in the schools, it is inherently collaborative. So
Definitely.
yes, you might be the only SLP on your campus, but depending on your district, you might have five other SLPs
Right.
in your district. You might have 150
Right.
on you in your district to rely on.
Right.
But I kind of want to, I'm so interested in the how right now. I also I have a caseload as well, and so I have some students that stutter. I would love to get some help on. I love the thought of like meaningful and functional goals. How
Yes.
come? Because when you said it reminded me of Maya Angelou when she says, "When you know better, you do better." But before
Yes.
that is that you are doing the best you can, and I want everyone to
Right.
hear that.
Mhm.
We are all doing the best we can,
Yes.
and we are all here right now today listening because
Exactly.
we want to know better, so we can do better.
Exactly.
So, all right, Claire, I really want
Yep.
to know, like, how should I be rephrasing my
Great.
goals, restructuring those?
Yes. So the first thing I want you guys to think about is this idea of strength-based goals and strength-based therapy, right? So I think you guys have probably even heard that before in some
Hmm.
sense. But really what that means, Dr. Scott Yaros and Dr. Nina Reeves actually
Yes.
talked a lot about that. They are huge in the stuttering world. They're wonderful, but they've definitely coined that term. I'm not taking credit for it, but they have really pushed for that
They've been
strength-based goal.
Nina's been on the
Has
podcast.
she? Oh,
She's
hi,
oh my
Nina.
gosh. Yeah, yeah. Hi,
I will be
Nina.
fangirling over her for sure.
Oh, I know. She's amazing.
She's
She's
wonderful,
amazing.
and so is her colleague, Dr. Scott Yaros. I've talked to him
Mhm,
before actually too. He's wonderful, and they are both just again a wealth of knowledge. Their website is phenomenal. If you want just some quick tips on again
mhm,
this strength based goal writing and strength based intervention, go to their site, Stuttering Therapy Resources. It's wonderful. But that's really where I've put my efforts in my goal writing is looking at the strengths. So I typically will word it something like will demonstrate this ability. So I
mm,
always have like an education goal. I so demonstrate education for stuttering, and that can be anything. So I really just want them to be able to describe stuttering. I want them to be able to maybe describe the speech machine and tension and how it's all related. So they'll demonstrate an understanding of stuttering through education of X, Y, and Z. Maybe it's facts and
Mhm.
myths, probably all the stuff that you guys are already doing. That's a really
Mhm.
easy goal to start with. And then I usually will also have a goal in either like advocacy, like I said, or social response. So with this, I might have a role play. We'll role play in certain situations, how to respond
Ooh,
to somebody
yeah.
who, yeah. And I love role play. Kids usually love role play
Yeah,
also,
yeah,
right? They
absolutely.
get such a kick out of it. So I think having a role play activity allows them to practice, it allows them to have fun, it allows them to do some voluntary stuttering and do some desensitization where they're getting more comfortable with stuttering in front of people, especially if they are masking more, because we're seeing that a
Mhm.
lot more is kids again from a young age will learn to mask their stutter, and it isn't necessarily a good thing, but it's harder to tell where all that tension is happening. So allowing them to kind of take the mask off and just let the stutter out, again, a lot less exhausting, but also they need to desensitize themselves to how it feels to just let it happen. So I think that advocacy goal going along with some role play is a really great idea for a goal. I also will always have an emotional regulation goal. So whatever step they're on as opposed or
Mhm.
whatever step they're on in relation to identifying emotions, labeling emotions, talking about the coping strategies related to their emotions, talking about coping strategies related to speaking experiences. All of those are intertwined and they all really are separate goals because it takes a while, right? If you have a
Mhm.
little kid at 5 who isn't even able to identify emotions or isn't able to label and talk about emotions yet, that's where you're going to start because we can't expect them to connect their emotions with solutions or coping skills yet. We need to get to that, okay, this is what I'm feeling, or this is what this emotion looks like in me. So, those are some ideas for goals. And again, that'll take you a little while to get to the overall coping skills goal. But I really like doing that, especially with my younger kids. I will usually, with older kids, maybe do some sort of avoidance reduction goal. So,
Mm.
once we get a little bit older, kids will start to demonstrate behaviors that are often related to avoidances. So, secondary behaviors are one of them. Vivian Siskin
Okay.
has done a lot in the area of avoidance reduction therapy, and I went to one of her trainings last year or maybe 2 years ago, and it was phenomenal. She has really dove into avoidance reduction therapy and how it relates to stuttering. And again, what
Mm.
we're seeing is that these secondary behaviors are often an avoidance to that tension or that uncomfortable struggle that's happening. And so, if we can start to peel away those avoidance behaviors, and it's not always just physical, sometimes it's avoiding situations, sometimes it's that word changing or that circumlocution to get away from that stuttered word. If we can take away those avoidances, and yes, the stuttering moment happens, but what it
Mhm.
taking away the avoidance does is it takes away the fear and the struggle. And then the stutter's just there. It's just the behavior. It's not a big deal. And it often takes away some of the tension too, because when the avoidance is there, the tension increases and then our emotions increase and it's all related.
So
So
it's vicious
the
cycle.
vicious cycle, yes. So I might have a goal of identifying their avoidance behaviors, and then I
Mm.
might have a goal about reducing their avoidance behaviors in like 4 out of 5 opportunities. When we get to these communication opportunities, I'm always asked about like how to take data, and I find more
Yes.
success in that opportunity based. So like different communication opportunities as opposed to a percentage of like, oh, I didn't hear an avoidance behavior, check, or oh, I did
Wow.
hear an avoidance behavior, minus. I do a lot of my goals based on report. So you can also do it on rating scales too, if the kid is old enough and can demonstrate and recognize that. So I might have a rating scale for the avoidances, one being, oh, I really avoided. Well, I guess that might be, oh, well, we'll do that. Let's
Yeah.
say one is really, really avoided, and I maybe that avoidance was word changing. I did a lot of word changing in this situation. 5 is, ooh, I felt really good. I didn't have to avoid at all. And so I'll have them rate, like, what were your avoidances like? And maybe my goal is somewhat something along the lines of they will report a 4 to 5 rating in their avoidance reduction rating scale. Maybe it's also a confidence rating scale. Maybe
Mhm.
it's a tension rating scale. Rating scales are great goals because it's person centered, it's related to them. It's also pretty easy because it's a check in. You're not constantly
Yeah.
taking data, you're checking in maybe in the beginning and the end of the session about certain situations. And yeah, there you go. That's what it is. So it's a lot easier to take data in that sense. If we take the pressure off of, well, it has to be a percentage and I have to mark
Mhm.
every time they stutter or I have to mark every time they avoid, if we just base it off of report, I think we can find a lot more success in that way and a lot more influential therapy and meaningful conversations in that way too.
The my sort of knee jerk when you're saying, "Yeah, we're gonna take data every time they stutter," that's a me. That's how I am feeling about
Yeah.
their
Mhm.
right? So
It is.
you've
It's on
totally
you. Yeah.
you've
Mhm.
taken their power. You're like, "I am
Exactly.
going" right?
Right,
"I'm going to
right.
be telling you when
Oh,
you're
I love
wrong."
that. Yes, exactly,
Oh, versus
exactly.
that's just that was such a I'm sure others as well are like, "Oh my
Mhm.
gosh."
Yes.
Really doing it really I love this. I'm going all over the place, but I
Yeah,
want to say
yeah.
being student centered. This is
Yes,
for them.
it is.
I mean,
Mhm.
from jump, you
Yes,
started off saying that when we're dealing with stuttering, it is for them, and we
yes,
need to take us out of the equation in the
exactly.
fact of oh, and
Yes,
down to how we even take our data.
exactly, and,
It
you know,
matters.
it does, and I think the question that I always get to what you just said, Carolyn, like, it's about them. The question
Yes.
I'm gonna ask myself
Mhm.
is, "So what if they don't care about their stuttering?"
Good one. Yeah.
And the question I usually ask back is, how do you know that they don't care about their stuttering? Especially because most of the time, at least from a lot of the SLPs I've talked to, they haven't yet dove into that cognitive behavior therapy and they haven't looked at what that student is thinking and feeling during those stuttering moments. They haven't necessarily asked the right questions about what's going on when you're stuttering. Yes, you're repeating. Yes, you're getting blocked. Okay, whatever. That's the physical thing. But what are you feeling and what thoughts are going through your mind? What situations are hardest for you? What is easiest for you? Because what I'll tell you is that even kids that I thought didn't care, I'll have them do like a situation hierarchy and just be like,
Mhm.
okay, I want to know what situations are easiest for you. And I won't even really bring talking into it. Just like, what situations are easiest? Tell me about it. So, like, let's think about school, home, talking to friends, talking to teachers. What's the easiest for you? Like, where do you feel the most confident? And we'll rate them. And what I find is, again, even students who don't care or say they don't care about
Mhm.
their stuttering will usually have authority figures, unfamiliar people, waitresses or waiters at
Mm,
restaurants
mhm.
ordering food, those types of situations where it is less comfortable and not as easily defined and just a little bit, again, a little bit more of pressure, time pressure situations, those situations will usually be on the top as more feared or more uncomfortable. And so that gets me thinking, well, why are we uncomfortable in those situations? And we start talking. And if they're still just like, well, I just feel awkward, like, I don't care, and they
Mhm.
don't start talking about their speech, maybe it's not related to their speech, but maybe it is. And I think we need to give them the space to talk about it in that way. And again, there are kids that might not care. And in which case, I would say give them the education, not just the strategies, but also the education of some coping skills and knowing that stuttering's okay and pointing them in the direction of resources like the National Stuttering Association so they can get involved in support groups if they want and set them free. If they really don't care, that's
Yeah.
fine. But what you might find is that there is some feelings related to their stuttering, or they do feel like they have to mask, or there are some avoidance behaviors that you didn't even recognize because they're so good at it. Those avoidance behaviors, like the word changing and circumlocution, especially teens can get really good at it if they've been doing it for the time they started
Yeah.
talking, right? So I think what I would challenge is to start digging a little deeper for those kids who don't care. And you might find that some of them actually do care.
I think this kind of The ones that maybe are saying they don't care, we're getting into, like, the middle school age,
Yes,
I
definitely. I
think
would
you might
say
be talking to?
even starting, like, 5th grade
Yeah,
probably.
late
Like
elementary or
yes,
yeah.
late elementary even, because they just start having more of a personality and they're
Sure.
more headstrong. And I think, there's this feeling of, well, I don't want to deal with it. Also, that comes up then is,
Mhm.
and I don't want to go to
Absolutely.
speech because my friends don't go to speech. There's a lot of stuff that's involved there. And I want you guys to know, as speech therapists, just because they're stuttering doesn't mean they have to be in speech. I think a lot of people think that, but they don't have to be. If they're not going to really talk about their stuttering, maybe they're not ready to yet. And that doesn't mean they
Mhm.
never will be, but there have been times. I actually recently had a 6th grader, I think he was going into 7th, that I had been seeing for a year, and we talked about things and we prepared him for some presentations, and he was very educated on stuttering. He knew a lot about it. And I let him go at 7th grade. He's still stuttering, and his mom actually wanted him to stay in speech. But I did a lot of parent education on how, he really isn't bothered by it. He's doing great in school. He has a lot of friends. He plays sports. He feels like he can talk to his coaches. Like, look at all those different situations. And if the child is doing well, it's okay. And I'll probably check in with them in 6 to 12 months and see how it's going. I would say that a child that continues to stutter will probably need maybe some redo of therapy in, like, the junior high to high
Mhm.
transition, and then maybe even the high to college transition, because there's new speaking experiences we can plan for and digest and just process together. But we don't need to keep them in speech forever.
I am such a believer of this, and I think speech school-based all of us that are school-based need to hear that students can still have a disorder
Yes.
and not need the
Yes.
specialized instruction of a speech language pathologist,
Exactly.
right? Because
Yeah.
if we go back to what our goal is with stuttering therapy, it's
Yep.
not to cure,
Fix it. Right. Mhm.
not to fix it.
Right.
So why would they be lifers?
Exactly. Right. Exactly. And I think that, again, that goes along with that fix it mentality that we all have,
Right?
which is wonderful. We're fixers. We want to help people. But if we can change our mindset to, well, we're helping them by letting them be accepting of who they
Mhm.
are and letting them know that it's okay to stutter and they're no different than anyone else. That's us helping them, not fixing it or not making them stop stuttering. If we can change that mentality, I think it would do a lot, not just for our students, but also take a lot of the pressure off of us as SLPs.
Right, talking about our caseload, but also I think if when we know that that student is no longer on our caseload but is still stuttering, the
Yes.
importance of continuing to educate the
Yes.
adults in their world.
Yes, exactly, because that's
And
what it
that
comes
might
down to.
exactly, and the acceptance and for the teachers and just the staff know
Right.
and how they should be responding.
Exactly. And I think most school districts will have the ability to have kids on, like, an intervention, or 504 is what we do, like, if they're on
Sure.
an intervention basis. So if your school district has anything like that where they don't need direct services, but you're there if they need you, so
As
that
an
they can come.
accommodation. Yes.
Exactly, as an
Yeah.
accommodation,
Yeah.
so that they have somebody in the school who really understands and who can talk to them. Because sometimes that's really all they need, is just to come into your room and not have to feel like they have to be fluent, or not have to feel like talking is so exhausting. They can come into your room,
Mhm.
you get it, you allow them to stutter, you allow them to talk about their stuttering. You might be the only one that talks to them about their stuttering. And sometimes that's all they need. They just need
Mhm.
someone to listen.
I love that. And again, right? If we can just put them on the accommodations that is letting the staff know that
Exactly.
are that they stutter and give them that opportunity,
Yes.
and
Yes.
that's all they need. And then we're not pulling them
Right.
from their electives. We're not pulling
Exactly.
them from their friends,
Because as
right?
they get older, that gets harder. And
Yes,
I
it
I think
does.
I think too, a question I get is, do these kids who stutter, especially as we get into the late elementary, junior high, high school age, do they need accommodations to presentations and to
Mhm.
oral presentations, or any type of like book report or whatever they might be doing in front of their class? And what I say to that is, again, it depends on the student. And I think the
Sure.
student needs to be involved in those conversations. I've had situations where my clients will already have these accommodations made for them because it's
Uh-huh.
assumed that they don't want to do the oral presentations. But when we talk to them, they say, "Well, yeah, but I can't because I stutter." Well, that doesn't make sense. What message did they get, right? And nobody probably said that to them, but that's the message that they received, that they're getting these accommodations because they stutter, that they can't present. And so I do think it's important to involve them, and it's important to give them their options. So if they want to try, great, they can give that presentation, or maybe they just give the presentation in front of their teacher. Maybe we just shorten it or make it a little
Mhm.
bit smaller, a smaller of a situation to a couple peers or just a teacher. Maybe they record it. I had a high schooler who chose that. He recorded his presentation so his teacher could watch them, and he wasn't going to be giving them in front of his class. So there are options, and I don't think that it has to be one way or the other. I do think it's important for kids to at least try some of those feared situations, because it goes
Mhm.
into that avoidance reduction therapy. If a child is never given the opportunity to speak in front of his peers, how do you think that's going to affect him as he gets older and in his job search and all of that? It will, even if he is more introverted. I just do think that we need to give them the opportunity to try things like that. So it doesn't have to be one way or the other. We can give them accommodations to support them in how they want to be supported.
Perfect, because that's exactly what accommodations are for. They're
Exactly.
for removing the barrier for the student,
Yep.
but it should be something that the student is using.
Exactly. Yep.
You hit it when you said a lot of times they come to you and they have accommodations put on them
Hmm. Hmm.
versus having accommodations working for them.
For them. I love that. Yes,
Yeah.
exactly.
Yeah.
Exactly. Yep.
So I feel that what I'm gleaning here is really our job is looking at total communication for them,
Yes.
that making sure that they are, communicating. What are some I'm just interested
Yeah.
for me, like give me some therapy ideas. Give me
Yay, I love
just
talking about therapy ideas.
yeah.
Yes, please. Well, so I wanna say first, I did talk about
Okay.
the goal for the rating scales.
Yes.
Please
Mhm.
make rating scales with your kids because it's usually really fun, and allow them to help you with it. All of my rating scales have Minecraft and Mario and the Disney princesses, like they all have characters on them, and all of the characters mean different things or have different facial expressions depending on what the rating scale is. So you can make those for confidence, you can make them for tension, but I think it's so important to allow your students, even from an early age, reflect on how their body is feeling,
Mhm.
how their speech is feeling in relation to tension. Again, we don't want to get into the habit of speech good and bad. Like it doesn't feel
Right.
good versus bad, but it can feel a little bit tighter and more tense versus a little bit easier and more flowing. Like that we can talk about, but we don't want to talk about good and bad. But those rating skills are so fun. It's a whole activity in itself, and it can again be copied and carried over into the classroom and then also into the home as well. So it can be
Mhm.
talked about in the same way. So I would do that. I also love having kids draw their stutter. This is not my idea. I think it might be from Stuttering Foundation, but I will have them just draw your stutter, like draw anything, and draw what it means to you to stutter, or draw you stuttering. And I get some really interesting pictures from that. I think it's really
Interesting.
cool. The most recent one, it was a 7-year-old who drew himself in like a little speech bubble, and it had the repetitions talking, and then there was the big bad wolf on the other side, and then there was this
Oh,
big,
wow.
like, something, not a tornado, but it was some sort of just like scribble. And so there was a lot going on there, and there was a lot that we could talk about. Well, the
Mhm.
big bad wolf is there. Why is the big bad wolf there? Oh, and he also had written take a deep breath on the side. And I was like, oh, okay, what is that into? Like, these kids are so reflective if we allow them to
Mhm.
be. I also think that writing and drawing, you could also allow them to write about their stutter. Writing and drawing takes the pressure off of them verbally communicating. I find that a lot of my older kids, especially, don't really want to verbally talk about their emotions. But
Right.
if I allow them to write about it, they will, or draw about it. I have a teen or preteen, 13-year-old girl right now who she won't talk to me about it, but I give her some prompts at the beginning of each session. She has a little speech journal and she'll write. She writes so much about her stuttering, and I write back to her. So
Oh.
I don't make it this conversation, but we have it through writing. And I think that's
Hmm.
really beneficial for how she wants to talk about her stuttering. So great, do that. I think speech journals are fantastic. It's a great way to track even data collection. If you want to track how the child is communicating in other situations, they can journal about it. Those are really great. I'm trying to think, what else do I do? Oh, I talked about the hierarchy before, and I'll do that in a variety of ways. Sometimes it'll be like a stoplight. So we'll talk about our situations in a stoplight visual. So, like, red is situations I really don't like, yellow is situations that are, okay, I'll do them. And green is, oh, yeah, I'm good. I love these types of situations. And so we'll talk about that in a sense of, okay, I feel good here. Now, what would it take for me to feel good in the green talking to the principal? And so we really digest that and talk about what thoughts and feelings are coming up. Again, going along with that cognitive behavior therapy, what patterns of thoughts come up in those feared situations, and how we can create more helpful thoughts to talk back to those unhelpful thoughts. And I love doing helpful thoughts with kids because it's really fun for them to come up with these like little mantras. My client I just saw, actually, his is I can handle it, because we read
Oh,
this
that's a
book.
good one.
There's a book called Mindful Mantras, I think it's called. Um, and it's this kid who says I can handle it to everything, and he loves the book, so we always read it. And so I think it's great for these kids to come up with these helpful thoughts that they can have to talk back to that voice in their head that might be causing them to shut down or causing them to feel a negative way. We all have negative thoughts, and it just happens. We can't
Hmm.
stop them, but what we can do is talk back to them so that it doesn't elevate our anxiety, or it doesn't elevate that fight or flight response to leave situations and to avoid things. So we can teach kids from an early age to have that positive voice talk back to that negative voice. And it could be really,
Love
really
that.
helpful for them from an early age, even if they don't stutter lifelong. I think, younger kids, it is possible that they will outgrow the stuttering, that they won't stutter when they're older. But still, how meaningful is it for them to have that type of positive self talk? It's going to be so good for them long term. So, regardless, I think we can work with kids on that.
That was
I
powerful. Sorry, when
Yeah,
you
go
said
ahead.
there's this a little thing when you said we can't stop negative talk, but
Mhm.
we can talk back.
Yes, we can. Yes, we
Because kids
can.
are always told, don't you talk back. But
Right.
now we're saying, actually,
Actually,
talk back.
yes, actually you
You
can. You
know,
have a voice. You have a
yep,
powerful voice, and you are in charge of your emotions, and you can make
yes.
yourself feel better. And I think that's a big thing too, is so many kids, yes, we talk to adults to help us, but our kids need to be empowered that they can make themselves feel better from an early age. They, of course, they want mom and dad to help them feel better, and mom and dad will make them feel better, but they can also do some things to help themselves feel better when mom and dad aren't around, or when the teacher isn't around. So, empowering kids to be aware of their emotions and know how to handle them is just so important for all kids, I think, not just kids who stutter, but all kids
Agree.
should be taught
I
that kind of thing.
I think I love that. That's one of my biggest takeaways I'm going with. We and not just in stuttering. I love that
Right.
this is a life skill.
Definitely.
We can't stop negative talk, but we can talk back.
Exactly. Yes. And
Love it.
that's why, if any of you listening are preschool
Mhm.
SLPs, why I still will do this type of thing with preschoolers. Maybe not, I'm not as direct about the stuttering piece with preschoolers, because often they don't grasp that concept yet until they're a little older. But we will do some of these coping strategies and emotion things, because if they do keep stuttering, they're going to need those skills. And so why not start from a really low age, or a really young age? So I think you can, these kids sometimes, we think these kids won't understand it, but they might surprise you.
Right. Sometimes we don't give our students credit,
Credit, exactly.
right? And
Mhm.
again, I'm going to go back to said about lowering expectations if we have too many accommodations or we put
Yes.
too many, right? It's
Right.
actually instead of removing a barrier, we're putting more in. And we want we want to have all students to have the highest of expectations. I
Exactly.
love the idea. I love speech journal. I feel
Yes.
like I need to do more of that. I think I need more, maybe just, what do you call that? A thought that,
Like
thank
prompts.
you.
Yeah.
Yeah, like
Yeah.
prompts.
Well, and you know what? You're inspiring me actually because I have
Well,
on my social media, I try and give some like my kindly speech social media. I to be honest with you, haven't been on in a while because I did have a baby 8 months ago. So I've been a little
well,
MIA on social.
congrats.
Thank you. I've been a
Yay.
little MIA on social media, but I like to provide on that social media account, Kindly Speech. I like to provide things to SLPs to do in therapy for kids who
Yes.
stutter. And that's such a great one of, okay, for these kids who have speech journals, who maybe aren't talking about how they're feeling about their speech,
Mhm.
what kind of prompts can we give them to start talking about your speech? And, sometimes it's as general as the draw your stutter or what does stuttering mean? And they can talk about, I'm sorry, they can talk about that. What does stuttering mean to you? Talk to me about, or tell me about a time you talked to your friends. Tell me about a time that you felt frustrated. Tell me
Ah.
about a time that you felt happy. So I usually will start very broad like that, and it will often lead into more specifics about speaking situations. The time you felt frustrated or time that somebody interrupted you, those will often lead into speaking situations, maybe that we can write or talk further about. But I do think just open ended, very simple, open ended things with some of my younger kids, it might be as short as I feel frustrated when, and then they
Mm.
just have to fill in the blank. So they don't have to write a whole thing if they don't want to. They just have to fill in the blank. Or when I talk to mom and dad, or when I talk to my teacher, blank. So
Mhm.
it gives them a lot of their own opportunity to talk about really whatever they want. And I don't put too much pressure on them or myself to like get all these situations out because you might not have a ton of situations to talk about every single time you see them. And so I think that's a big thing I've learned about therapy over the past couple years working with people who stutter is that not every session is going to be a life-changing session. I think we
Mm.
can change these kids' lives. I absolutely do. But I think sometimes I, and I'm sure other people, put a lot of pressure on myself every session to be this like life altering experience for these kids. And it might not be. For kids who stutter, it may take a couple months to build that trust with you for them
Mhm.
to talk about how they feel. Even young kids, they need to trust you, to trust that you can hold their emotions and that you can hold that space for them to talk about their
Wow.
emotions. So I think that's okay if sometimes we are just really sitting there with them and talking and building rapport and educating them. That's okay. And you will find that the sessions that there is some breakthrough makes it so much more impactful and, not just for you, but for them. And you feel like you really have broken through because you've built that trust and because you have that relationship with them. We really need that first.
Mhm. What about having students write a disclosure statement to,
Oh, that's a good
yeah,
question. Yeah. Yeah, I love that if they want to. I would
if they
say that
want to?
yes, that would be my caveat to that is if they want to. Some students won't want to disclose that they stutter. Some will, but I would say that I would leave it up to them.
Okay.
Yeah.
And do you have any guidance if you're working with a student where maybe wanting to work towards being able to have a disclosure statement?
Absolutely. Yeah. So again, it depends on what age they are and in what context they want to disclose.
Mhm.
For students, it usually starts with some sort of situation. Maybe it's a talent show or a book report
Yeah.
or a group. So maybe they have something they're working towards, which is amazing. Like we might work for a couple months toward this specific speaking event. And I talk with them a lot on, I think they need to know that they don't have to say they stutter, but they
No.
can say they stutter. And I also think it's important to let them know that if they choose to disclose and if they choose to say, hi, my name is so and so, I stutter, and then give a little bit of information about them, it might make them feel a little less anxious because then others will know what it means when they repeat or when they get stuck. And it's a double edged sword because we want the listener to already be patient and not judge
and
others.
and kind.
And kind, right, exactly, but unfortunately, we can't control other people, but we
Right.
can control what we say and how we disclose if we choose to, and I think that's the difference between students who choose to disclose versus not, is they will either really want to be in control of how those listeners are perceiving them, or they don't care and they'll just have the listener feel whatever they feel. And both are right. Neither are wrong. Both senses are right. But I do think it's good to let the child know that it's an option. You might find when you say that to the student that they're like, why would I do that? And then
Yeah.
they'll warm up to the idea as you keep talking about it. That's what I found, because I'll just kind of throw it in here and there, like, oh, you could also say that you stutter and this is what stuttering is. But usually the first time I ask about disclosure, they will not want to, and that's okay. But I think just dropping little hints about it as we go, especially if we're leading toward a bigger speaking event, and showing them that it can be impactful is good. But one way or the other, it's whatever they feel is the best option and best decision for them.
I love it. Yeah, I love the idea that again, student centered.
Yes, all the way.
We're not forcing you to tell everybody and
Exactly.
disclose,
Right.
but maybe in certain situations it
Mhm.
might actually benefit
You
you
as a person.
if
Yes.
before you are going to embark on something
Right.
to disclose,
Mhm.
I am a stutterer.
Yep.
My stutters are going to look like this.
Yes.
You're
And this is
welcome.
what you can, yeah, exactly, you're welcome, right, and move on.
You're
Or
welcome.
even, I want you to just give me the time, or please don't interrupt me. I sometimes with disclosures will, have them say what they want from their listener,
Mhm.
because a lot of
Yeah.
times that's what the listener doesn't know is, okay, how should I respond? So I'm so and so, I'm a person who stutters and I just need a little bit of time, or please don't interrupt me. I know what I want to say. So giving just a little blip of what they want from their listener.
That's perfect. I like things that are short and
Yes,
sweet
exactly.
and is really just going to benefit the
Them.
stutterer.
Yes, because that's
Um,
what it's about.
it is. It's I'm a stutterer.
Mhm.
Please don't interrupt, or
Yep.
you are going to hear me stumble.
Yep. And I think ask your students, how do you want people to respond to you when you
Yeah. Oh,
stutter?
powerful.
Exactly. I don't think enough students are asked that. Like, how do you want people to respond? Most of the time, when I ask students that, they'll say, I just want them to listen. Like, I don't want them to do anything. And I think this is especially impactful for parents, because parents
Mhm.
really try to help their children, again, out of the love in their heart
Love.
for them. Yes, they try to help them. But really, their child might just want them to wait and might just want them to let them keep talking instead of trying to fill in the blank or rush them or whatever it is they're doing that they think is really helping. So if you can have that conversation with the parent, I know it's hard in the schools, we might not see them a lot, but at meetings, at IEP meetings, if we can get
Mhm.
that conversation going between the child and parent, that can be really, really powerful.
Their disclosure statement could be to their parent.
Exactly.
I
Yes.
mean,
I love that.
that would be, I mean, very today,
Yes.
you
Yes.
know?
You can do that right
Um,
now. You can start planning for that. Exactly.
mhm.
Yep.
I love that.
Yeah.
Okay, is there anything we haven't gotten to? I know we
That
have
went so quick.
I know, we have a few more minutes.
That's okay.
I just wanna go back. I love when you're talking about the ABCs of
Yes.
stuttering, and the part that we all tend to jump on is the behavior
Mhm.
portion because that is something that we feel is tangible.
Exactly.
And we're and I think and you said and we all agree that how we have been doing things is
Mhm.
okay,
Mhm.
but now best practice and new research and what the science is saying
Mhm.
is we need to start expanding that. Now we
Yes.
don't I think I also heard you say
Mhm.
we're not throwing away the baby with the bathwater.
Nope.
We still need to have those strategies. Those
Right.
still have their place,
They have
but
their
that's
place.
not the end all be all.
Exactly. And I think that's exactly it, Carolyn, is they have their place. I think that you don't have to be on one drastic side or the other.
Yeah.
I think some SLPs are, and that's fine too. I do think though that having the knowledge and giving your students the knowledge of what's out there when it comes to
Hmm.
stuttering therapy is the most important thing. And so we have to go beyond just the strategies because there is more out there than just the strategies. So allowing them to know that, hey, there's other people who stutter and this is what they say. I think even letting them know that there are other people who stutter, so many of my students have never met anyone who stutters. And so connecting them with support groups, the NSA has a ton of free support groups for these kids and their families so that they can see others who stutter and who are working on the same things that they are. That in itself can be so impactful.
Mm.
And that can help that emotional piece and that cognitive piece to, okay, I'm not alone in this and it is okay to stutter and I can still be a communicator or I can still do these things and stutter.
Right. It's not going, we want to empower
Exactly.
the student with their communication. I think
Yes.
it's important to be that resource for the parents and having giving them those support groups where they can be talking with other families
Mhm.
because they might not have
Right.
anyone
They
else
may
to
not know
talk to.
anyone. Exactly.
Exactly, and
Yep.
they're just trying to love their kiddos.
Right. We're
Um,
all just doing the best we can.
100%. Absolutely,
Yep.
absolutely. Thank you so much
Thank
for
you.
coming today. This was wonderful. I
Yes.
think you're doing amazing work. So I'm gonna and congrats on the new baby.
Thank you.
I I love that. And so we could go on to Kindly Speech and
Yes, Kindly Speech
okay.
LLC is my Instagram handle. So you can find me on Instagram and then you can also email me if you want, kindlyspeechllc@gmail.com. And if you have any questions or cases, I frequently have people
Yes.
email me about cases and I love hearing about them and I love talking about cases. So please feel free if you have a question or if you want me to go into something further that I talked about, I am happy to collaborate. So please feel free to reach out on Instagram or email me.
Thanks for joining me this week. If you have a moment, please subscribe and review the School of Speech podcast on whatever platform you listen to. It really, truly helps a ton. And I would love to hear what you think. All right, guys, until next time, bye bye.